Welcome to Channel Health and Alerts. Do you know what sickle cell disease is? It's a group of inherited red blood cell disorders that affect hemoglobin, the protein that carries oxygen through our bodies. Imagine, instead of being disc-shaped and flexible, the red blood cells become crescent or sickle-shaped due to a genetic mutation. These sickled cells can block blood flow, leading to serious complications like stroke, eye problems, infections, and episodes of pain. Let's delve deeper into this lifelong illness, starting with its symptoms. Sickle cell disease is an inherited disease, and while newborns usually don't show any symptoms until they are about 5 or 6 months old, early signs could include a yellowish color of the skin or the whites of the eyes, extreme tiredness or fussiness from anemia, and painful swelling of the hands and feet. And how do we diagnose this disease? Prenatal screening, newborn screening, and blood and genetic tests are used. These tests can determine whether you carry the sickle hemoglobin gene and what type of sickle cell disease you have. Now, what causes sickle cell disease and who is at risk? This disease is inherited, meaning it runs in families. If a person carries one copy of the sickle cell gene from one parent and a normal hemoglobin gene from the other, they have what's known as sickle cell trait. Most people with sickle cell trait experience no symptoms and lead normal lives. However, those with sickle cell disease carry 2 copies of the altered hemoglobin gene and often experience symptoms and complications. So, what are the treatment options? Currently, a bone marrow transplant is the only cure for some patients. Medications or transfusions may be recommended to manage complications. There are also medicines like voxelotor, which prevent red blood cells from forming the sickle shape, and crizanlizumab TMCA, which helps prevent blood cells from sticking to blood vessel walls. And then there's hydroxyurea, an oral medicine that has been shown to reduce or prevent several complications of sickle cell disease. Living with sickle cell disease means receiving routine follow-up care and getting regularly vaccinated as per doctor's guidelines. Learning what to do in a pain crisis is also crucial. Drinking lots of fluids, taking NSAIDs, applying heat to the area, and seeking hospital care if the pain cannot be managed at home are all important steps. So to wrap up, sickle cell disease is a lifelong inherited disease that affects the red blood cells. Early symptoms can include jaundice and swelling of the hands and feet. Diagnosis is through prenatal screening, newborn screening, and blood and genetic tests. The disease is caused by carrying 2 copies of an altered hemoglobin gene. Treatment options include a bone marrow transplant, medication or transfusions, and living with the disease involves routine care, vaccinations, and managing pain crises. Remember, sharing is caring. Reset health, reset life.